Okay, in three, two, one. Hi, everyone. Welcome to Sandy K Nutrition, Health and Lifestyle Queen. Today with me, I have a special guest, and his name is Dr. Mike Sinel. He completed his residency at Cornell University Medical Center and Memorial Sloan Kettering in New York, and Dr. Sinel served as Director of Outpatient Physical Medicine at Cedars-Sinai Medical Center. He is a nationally recognized expert in spinal disorders and pain management who has authored several scientific articles and two well-known books on back pain, including Back Pain Remedies for Dummies. He is the owner of Physician Therapeutics. He is passionate about reducing the side effects of pharmaceuticals by bringing safe, scientifically proven, encapsulated medical foods as natural alternatives for pain, sleep, obesity, neuropathy, fatigue, and cognitive decline. And today, we're going to talk mostly about pain management. We're going to talk a little bit about the drugs that are used for pain management. And we're going to talk about these proven encapsulated medical foods. So with that, welcome, Dr. Sinel. Thank you so much for coming today.
Thank you. Glad to be here.
I'm pretty excited to talk to you about this because it's a huge topic. I mean, we live in a world where we want to be able to rid ourselves of pain easily, which is never really that easy, and it's not an easy solution. So, how did you get into this entire field of medicine?
Yeah, I mean, pain, my specialty, physical medicine and rehab, a big part of it was, orthopedics, neurology, rheumatology, but many things that crossed with people with pain. I mean, it's a much wider field, and it's also a very holistic field. It looks at people's lifestyles, it looks at psychosocial factors, environment, psychology. I was a psychology major undergrad, and I was always fascinated with the mind-body connection. And I went into this field, and pain was a big primary symptom of a great number of the patients, especially back and neck pain, which are ubiquitous. I mean, the amount of percent of people that suffer from chronic back pain and disability is enormous. And I ended up specializing in outpatient physical medicine pretty much, and pain management. So I was dealing with people coming in with pain, everything from very acute, like, ooh, bent over and sprained my back and some sports medicine, sprained my knee, or went into spasm, to people who had 4 back surgeries and were suffering from chronic pain and disability, and everything in between. So I dealt with the entire spectrum of pain management, from acute musculoskeletal injuries, sprains, to chronic disability and severe complex pain disorders. And it's a fascinating field.
Well, I think it is also because it's never just about the pain, right? Because the fact of the matter is, you're dealing with patients who can fall into pretty severe depressions because chronic pain, I've seen it. I've seen it. My husband actually suffers with chronic knee pain, and my father has osteoarthritis, and I can see it when it's taking them over. So it's much bigger than just that knee problem.
Yes. And I'm sorry to hear that. And again, super common. And yes, because it affects your life, your function. Clearly, if you're in pain, it's natural to get depressed. It sort of goes hand in hand. It's common to have sleep disorders. It's common to have fatigue. It's common to have obesity. And all these things become vicious cycles, especially in chronic pain. And the mindset is very critical. And because this is somewhat a disease of our nervous system, chronic pain. It's different than if you stub your toe, which is acute pain, and we understand that a lot better. There's pain signaling from the nerve fibers and goes through the spinal cord, and you're like, ouch, but you reassure yourself, and it tends to get better when the inflammation settles. And chronic pain's a whole different story.
Yeah, I think chronic pain is definitely something we can dig into as it relates to the drugs that are used to manage it too. Okay, one
Yes.
second. I just realized I just hit stop on the audio because I'm on the wrong Wi-Fi network. Oh my God. Sorry about that. Okay, I'm switching back. One sec. One sec. One sec. Uh, are you
Yeah,
there?
we are.
Are you
I
there?
am
I'm so
here. You've
sorry.
been, no worries, no
You know
worries. You've
what?
been
I had an
frozen, but you're back.
unstable network, and so it's okay for the video, but now I'm going to keep rolling with the audio. And I do apologize for that. Usually I check the network before I have a couple of different networks. Sorry about
Hmm.
that. So now I'm going to
No
continue.
worries.
Okay. All right. So let's get into how we manage pain in typical, Western medicine. What do we do?
Yeah, well, we haven't managed it very well, as we can see, as we're in the midst of an opioid crisis, which is horrifying. I mean, in the US, it's the last 3 years killing over 100,000 people per year. Massive societal problem. And it's a global problem, but I know the data in the US pretty well. And, it's because we've not really had a good handle on pain management. I mean, there haven't been many ways to address it. There's things like Tylenol as a basic over-the-counter medicine, and non-steroidal anti-inflammatories like everyone knows ibuprofen for the most part, and naproxen, Advil, or Aleve. And these can work in acute pain at times, but it turns out the more we learn as time goes on, more and more literature shows there are significant side effects and actually real dangers when people use these chronically. Many people have chronic pain. They may have chronic osteoarthritis and chronic back problems and chronic knee problems. And if you're taking these long term, you're getting all sorts of toxicities, everything from kidney and liver with Tylenol, kidney with nonsteroidal anti-inflammatories, and cardiac toxicity, especially gastrointestinal disorders, including bleeding. And
Yes.
many people get very, very sick from the side effects of these pharmaceuticals. And many people die from them, actually, from side effects. I mean, people get bleeding ulcers, people get cardiac events, and we're learning more and more. And we're also learning recently that chronic use of these non-steroidal anti-inflammatories has actually been shown to promote chronic pain.
Mm.
So, which is a whole new concern, right? And in the medical profession, we haven't really had, at least in a medical profession that has historically relied on taking the magic pill and pharmaceutical interventions. The jump from non-steroidal anti-inflammatories and Tylenol was opioids,
Mm.
which was for severe pain. And as you can see, we have a horrible opioid crisis because they're highly addicting with loads of side effects. And many people ended up with getting some post-op pain medication, went home after a knee surgery, and the next thing you know, they're addicted to OxyContin and their life gets ruined.
Yeah.
And these are highly addictive substances. And there are alternatives on the horizon that I'm very excited about, at least pharmacologically. But my passion, what I am here to speak about, what got me into this, is they're actually natural products. We have these encapsulated medical foods, which are a strange category in medical foods, because when I first heard of them, even though I had been practicing for a while, I thought, what is a medical food? Like a green drink or a bar, proteins, I thought. But it turns out these are encapsulated products that, easiest way for me to explain it is there's supplements on the one hand and there's pharmaceutical meds, because everyone knows those categories. You know, everyone knows pharmaceuticals are either prescription or over the counter.
Yeah.
Both of them, though, have massive side effect profiles, including something as simple as ibuprofen. And then there's supplements, which are not FDA regulated and are not regulated for their manufacturing, which is a very big problem because, many studies have been done showing what the label says or what are claimed to be in these supplements are often not. Now, not to say that there aren't very good brands of supplements out there, but it's very hard for the public to discern.
It
It's
is.
somewhat of a market. It's somewhat of a marketing game. I mean, you're in the nutritional field, so you know this. Many companies just had a lot of money, through a lot of marketing, got the right influence, so boom, it's out there. I think very important for people to understand about supplements is, they're not able to make claims that they treat a disease because that's just the laws within the FDA, right? And
And in Canada, yeah.
yeah, and in Canada, and they don't really have typically human clinical trials. Like in pharma, you have to go through human clinical data. Now, uniquely, this category of med foods, which I was fascinated when I came across these about 10 years ago, and I'm going to use one of our lead product, which is for pain and for chronic pain and inflammation. It's called Theramine, but I'll use it as an example to illustrate the story and my whole journey in the medical foods arena. So I was practicing, and I had a lot of people on pharmaceutical meds, even though I was always trying to employ multiple different techniques for pain, including acupuncture, including mindfulness meditation, including yoga, including massage therapy. I mean, I could give you a long list, but I was always oriented towards integrative medicine and integrating the best of East and West, and also techniques related to the mind-body connection, because in chronic pain, so much has to do with the meanings you attribute to the pain and how you function in the messaging. So it's very complex in terms of how much of the pain you're actually experiencing, which is an emotional experience of suffering, how much is due to actually a stimulus. Like you could have chronic knee pain, and we could give 10 people the exact same anatomy in their knee problematically. Like, let's say they all have the same degree of arthritis and their x-ray looks differently, but there may be 8 radically different descriptions of pain, or 10 radically. Some may have pain 1 out of 2, and some may have 9 out of 10, or 1 out of 10 and 9 out of 10, strictly because of what's happening when those signals are getting to the brain, and lots of complex mechanisms that play into them. So anyway, I was always about looking at pain from a holistic viewpoint and using whatever we can, especially safely. There's no downside for a lot of interventions, especially things like meditation and hypnosis, and even
Acupuncture.
and yoga and acupuncture, right? And I could go on, right? So I was always oriented to, of course, we're going to try these because there's no downside, and everything in medicine's a risk benefit. If I'm writing for a prescription, even if it's ibuprofen or they're taking it over the counter, I know there's a risk. I know there's a risk of cardiac disease side effects, kidney side effects, very common to have gastrointestinal side effects, bleeding, ulcers, serious stuff. Tylenol could give you liver toxicity in high
Yes.
doses, or if you're sensitive. So, and then there were the opioids. So I used these carefully in my practice when I had to, but always was trying to bring people to safer alternatives. And then I came across, again, using Theramine as the example, which is the first one I came across. I'm in a friend's office, a fellow UCLA colleague professor who had an active pain practice. We were going for lunch, and I saw in his clinic the nurses giving out these bottles of Theramine. And I was like, what is that? He goes, you don't know about Theramine? It's this incredible medical food. And I'm like embarrassed because I'm teaching at the time about pain on the podium in many departments. And like, wow, never even heard of the category medical foods. And he explains to me, he goes, look, it's not a supplement. These have very big science. And in fact, they're studied against pharmaceuticals. He goes, Theramine has published studies, head-to-head studies against ibuprofen and naproxen, with all natural ingredients. And I was like, what? All natural? He goes, yeah, no side effects, no drug interactions. These are amino acid formulations that are essentially a combination of amino acids and botanicals. They had a patented amino acid technology that was producing neurotransmitters, which it turns out many of these disease states were deficient. And by replenishing the neurotransmitters, you are balancing the body at a cellular level and promoting natural healing. And again, the bottom line for me is, wow, they're perfectly safe. All the ingredients were GRAS, which the FDA means generally recognized as safe. So that's like vitamins, minerals, herbs, amino acids, any of those. These in particular were amino acids and botanicals. So the
Wow.
ingredients were all safe. The manufacturing was all regulated. So it was CGMP manufacturing, which is pharmaceutical grade. It's certified good manufacturing practices. So the manufacturing was, CGMP, high quality. The ingredients were all natural. There were human clinical trials, which were incredible because that's the gold standard, like double-blind, placebo-controlled trials
Yeah.
showing decrease in pain with zero side effects. So I said, all right, I have a perfect safety profile. I have things that are working and natural with no risk to my patients. Why am I not going to try them in every pain patient? And hopefully I'll get them down or off some of their other meds.
Right.
Even if I use some of their meds in combination, right? And could lower the dose. So like one of the studies we had with naproxen showed you could reduce the naproxen dose by 70% when combining it with theramine and get the
Wow.
same effect. And as you might know, if you reduce the dose by 70%, you're eliminating like 95+% of the side effects because they're dose related. So, so these could be used as adjunctive care, or some people were just able to take them and get off anti-inflammatories, off down on some of their opioids. And then, so I'm reading about these and looking at the literature and go, oh my God, I owned a bunch of clinics in LA at the time. Some of them were integrative with chiropractors, but at the time, these were prescription only and they were being reimbursed by insurance. So I was like, okay, this is all natural, but they're prescription only,
Yeah,
but they're
that's
being
weird.
reimbursed.
Why would
Yeah,
that be?
exactly. Well,
Because amino acids are not a drug. How can they be a prescription?
well, I'll tell you. So they were,
Okay.
because this was a unique category, and the manufacturer of the products opted. He was a pharmaceutical manufacturer, and the inventor, who was brilliant, but unfortunately had a bad strategy and priced these too high. And he basically wanted to get Medicare approval. And by the way, I credit the effort because the truth is, these were an FDA regulated category. He made them prescription only with the intent of getting them covered by insurance, especially Medicare, and then making them available to everyone, especially seniors who have Medicare, who need them the most. Because when seniors take these, and they're much more susceptible to side effects, that they
Totally.
could, seniors, they get a bleeding ulcer, good chance they could die, right? Or
Yeah.
a cardiac event. So his strategy was appropriate, and I was prescribing them and they were getting paid. But to make a very long story very short, because I was having great results and was very excited, and I was using theramine for pain and inflammation, and tretinoin for osteoarthritis, and centropm for sleep, which was studied against trazodone, which was one of the biggest widely prescribed, sleep medicines on the planet. I was like, wow, I'm getting people down on sleep medicines to low doses or sometimes off them with this centropm, which is just regulating parasympathetic tone and getting people good sleep, and had good human trials. So I
Okay.
was fully sold, and they were being reimbursed. Ultimately, the FDA came in, re-regulated the entire category, said no longer prescription only.
Good.
The company continued to fight the battle for Medicare, but they lost, right? And I ended, and they had these priced and getting reimbursed at $400 a bottle, and which I thought was crazy. But in any case, that's what was getting paid. And I came ultimately, when then they were unable to pivot after 6 years, I was able to buy this company because I want to democratize these and I want to get them to the world. And now there's certain countries, because I go through each, we're just rolling them out globally. As I mentioned, my partner is the ex-CEO of GNC. My other partner is the head of Stanford's Health Innovation Lab. Stanford's a research partner. We have my chief medical officer was the executive medical director of Herbalife. He was like head of their medical division and like one of the authorities in the country in nutritional medicine, and Harvard trained doctor who wrote textbooks. And our goal is to just bring these out now in several countries like Canada, which we just got approved in 4 days ago. We opted to just go the supplement route because I just want people to take these and understand how important they are as an option, just as an option, because they're perfectly safe. We have over 40 million doses prescribed over the years without any real significant adverse side effects and very good results in many, many categories. So Canada, we will be a supplement. In the US, we are medical food. We're selling now in China. We're selling in Vietnam. Some countries, it'll be supplement. I'm in the Middle East now, going the medical food route, working with one of the biggest distributors in the whole GCC region, specifically to try to go the insurance route here, because
Okay.
they are distributing, they believe they could do that. We'll run it through doctors and hospitals and pharmacies. But I just want people to understand this category and
Yes.
our human data, and to consider them if they have pain problems, sleep problems, fatigue, cognitive decline, even obesity. We have a natural appetite suppressant because the pharmaceuticals, which look, could have a role for people, but people need to understand chronic use of pharmaceuticals. There's always a significant risk.
Yeah.
In these, you have no risk.
So
And
let's
I brought the price down tremendously, and your readers or listeners, I should say, no one
listeners
reads, will
or
get a
watchers or
tremendous,
watchers.
yeah, watches will get tremendous discounts. So they'll be like under $50 or something for month
Okay.
supply, or, and I
We
want to bring them to practitioners.
we need to back up. And I'll tell you why, Dr. Sinel, because we may have some listeners who don't know what amino acids are. So I think it's really important for listeners to understand that amino acids, they're the building blocks to protein. So let's say you're eating a piece of chicken, right? I don't know how many amino acids are in a piece of chicken, but thousands, right? So these would be amino acids in isolation, right? Does this make sense?
Mm-hmm.
And they act almost like a signaling molecule in the body to help whatever it is they've isolated for. Does this make sense? Is that a good way to describe it?
So you're accurate in saying amino acids are the building blocks of proteins, right?
Okay, okay.
Amino acids also, and the ones we use in the science behind our company, is we are giving amino acids that are precursors, that are the building blocks of neurotransmitters. So we are
Okay.
really in the neurotransmitter science game with our amino acid technology. So there's a
Okay.
patented amino acid technology. So what's happening here is we're providing the precursors of these neurotransmitters. So let's take an example like acetylcholine is a neurotransmitter. And to back up, I'll say what neurotransmitters are.
Yeah, yeah.
Neurotransmitters, so they are they're the signaling molecules that tell cells what the chemicals that are telling cells what to do.
Yes.
Right, and they innervate cell to cell throughout our entire nervous system. Okay, so it turns out in many disease states, there is an increased metabolic demand on the body when it has a disease. If you have chronic insomnia, like sleep disorder, right, or you have chronic pain and inflammation, right, so as you can imagine, your body is out of balance. So it's under an increased demand metabolically at the cellular level, right?
Yeah.
So it turns out this is like if you think of a car running uphill, it requires a lot more, right? Like my Tesla in particular. If I go uphill, the electricity use is way higher than I'm on a flat surface. A car is going on the highway at 60, it's efficient. If you start going up a big hill, you're using a lot more gas. So that's the
Yeah.
increased energy demand, right? Metabolism, energy. So the cellular level, when you're in a disease state, you have an increased metabolic demand, increased energetic demands, right? So you need, you know, increase activity of your cellular mechanisms to meet those metabolic demands, and you need increase amino acids and increase neurotransmitters to signal to meet the metabolic demands of the disease state. So it turns out in all of these disease states that we are addressing, chronic pain and inflammation, chronic sleep disorders, neuropathy, etc., that there is a relative depletion of the neurotransmitters because of that increased metabolic demand. So there isn't the optimal level of a neurotransmitter, which means the body at a cellular level is not functioning optimally. And what we do is we bring that, we increase the neurotransmitters that are depleted. So we're trying to replenish the depleted neurotransmitter levels and bring the cells back into balance so that the body's optimized. And as you know, the body's the most miraculous natural healer. You just have to put it in an optimal state, right? So this is food as medicine. Yes, it's in the form of capsules, but these are food, right? Because medical food. So we're using these amino acid precursors, which produce these neurotransmitters like choline bitartrate is the precursor to acetylcholine, which is a significant neurotransmitter, which plays a role in the pain pathways. Just like GABA is a neurotransmitter, right? It's an inhibitory neurotransmitter. So it'll decrease signaling pathways of pain. And, you know, we have L-arginine, which will produce nitric oxide and cause vasodilatation, and also, you know, blocks transmission of certain sensory pathways through the spinal cord, transmission of pain. So all these different amino acids we are providing, the precursors of the neurotransmitters, with our technology, the patented messenger amino acid technology, and with these certain botanicals, maybe grapeseed extract, maybe caffeine at times, microgram amounts, they work together to produce neurotransmitters, balance the cells, and promote natural healing. So you want to optimize the body to heal naturally, and that's it. So it's neurotransmitter science.
Beautiful.
And hopefully that was a
great explanation. That was a great, because people want to understand, you know, obviously not from a physician's point of view, but from a how's this going to help me, and how is this different than taking drugs? How is this different than taking a regular supplement? So, you know, there's people who will just simply supplement with GABA, right? But this is not the same. This is
not at all.
This is the signaling molecule that will upregulate the neurotransmitters naturally, as opposed to taking the supplement GABA.
Yes, and that won't typically do it. So you said something really important I want to expand upon, super important. People want to understand it. You know, I want to really simplify it for people, because this is all someone should really understand. Right now, if they have chronic pain and inflammation or a chronic sleep disorder, they have a choice. They could take a pharmaceutical med, which we know has a lot of potential side effects for them. May help, but be careful. You know, long-term significant potential risk, and even short-term. Some people get confused and fall down and break a hip if they're elderly, and you know, it can affect memory. And so we all know pharmaceuticals have their place, but we also know we have the concerns with their side effects, right? They're synthetic molecules, new chemical entities. We also know that supplements, some are good, some are bad. Very hard to discern. But what you need to know, and what the public needs to understand, is most of them are based on theoretical scientific mechanisms, not actually human clinical trials. Our products were studied in humans. We know they work, and we know they're safe. Are they going to work 100% of the time? No. Are they going to be safe 100% of the time? Yes. So if you know it's perfectly safe because it's been tested, and we have 15 years of data, but we have published trials in humans, and that's the gold standard of science here.
Yes.
You know, with ibuprofen, with naproxen, showing perfect safety, with the biggest sleep med, trazodone, one of the biggest. So all you have to really know, and I even tell doctors this, I go, look, you could talk to me about neurotransmitter science and mechanisms and our 5-step amino acid technology. I go, but what's the difference? If I tell you I have a published trial and I know it's safe because of the ingredients and our history, and I know it shows effectiveness in the human trial, That's all you have to know. Me as a doctor, all I ever have to know is, hey, what's the data here? If I know something's safe and has no risk and has a very good chance of working, I'm going to try it because
Yeah.
everything's a risk benefit. So that's really all your listeners have to know. And that's really all the doctors have to know. Like,
All
there's
right.
no reason not to try it. They
Yeah.
could try all sorts of supplements that theoretically should work. Look, melatonin, people talked about mechanisms. Now we're finding all sorts of problems with melatonin, throwing off circadian rhythms. It's one of the common supplements for sleep, right? It's produced naturally. It sounds great, but many supplements, good theoretical science, we look over time and we see lots of problems. Melatonin showing lots of problems. Now there's some study on fertility in young males with melatonin. You know, there's just not that many real options for the things. And we have very safe, scientifically proven options for many of the most major disease categories, you know, fatigue, cognitive decline. These have worked. We have data in PTSD and, you know, in fibromyalgia patients. We're going into the Veterans Association and you know, in the States. And, you know, again, my goal is to educate people, bring these out globally. Some countries like Canada, because it becomes too difficult to worry about the you know, the regulatory pathways to become a medical food. If it's going to take years, I'm not going to wait. I'm just going to say I want to get this to the public. Fine, I'll register it as a supplement. They'll regulate the claims I could make on my bottle, on my label. In the
Yes.
US, it requires physician supervision for me to make the claims. I have on my bottle requires physician supervision because that's mandatory for the medical foods category. And we want people to have their physician oversee their osteoarthritis. And we don't want to tell someone, just take this and stop all your prescription meds. It's better the
Right.
physician better the physician lowers your sleep medicine and oversees your sleep disorder. We want to put it out there as an option for you, which is a natural, safe option, and let your physician supervise the disorder. And we love to educate physicians.
Yeah. Okay.
Sorry,
So
sorry. I get going because I'm passionate. So
that's okay. Hey, I feel you. I'm passionate too. So what I'm going to say too, because it's important that I make this, put in this disclaimer. We're not giving any medical advice here. We're providing information, and it's important for you to
mhm.
have this discussion with your own physician on, you know, if you have to titrate down or whatever from your other medications. So we're not giving medical advice here. I just want to make sure that that's noted here. Talk to your own practitioner about what's right for you. We're just providing you with education that there are other options. That's all. And
Or please let your physician talk to me, because you know they could go to medicalfoods.com and have lots of information and our published studies. But
yeah,
please, I'm Dr. Mike at medicalfoods.com, and I encourage you to tell your
there you
doctors
go.
to let me educate them.
Yes, because the biggest, I think the biggest challenge is, you know, I hear things like this in the US as well, but in Canada, you know, our general physicians or our specialists are specialized in their one area, one small area, which is why providing your physician with a website and saying, "Hey, I heard about this, you know, let's look into this." Because you also need to be a partner in your wellness journey. That's just the fact.
Mhm.
So have the discussion with your physician. Now, and the other thing, you know, Dr. Mike and I were talking about this. I think we need to circle back a little bit, just a little bit, about how easy it is to get hooked on medications that you never had any intention on getting hooked on. And I'm going to give my example that I was talking to you about offline.
Sure.
So my
Yes.
daughter had her wisdom teeth out, and I'm not a pharmacist or a medical physician or anything, but I know a little bit about medications. And I'm like, what is this drug here? They provided me with a prescription. And I said, is that an opioid? And they said, yes, it is. And I'm thinking, my God, why would, you know, a child under the age of 18 need an opioid after getting wisdom teeth out? So I want everybody to know that you have the option to say, no, don't fill that. I'm good with that, because I actually personally don't want that in my home. But Dr. Mike, can you please expand on the dangers of getting addicted and how easy it is to become addicted on an opioid.
Yes, I mean, this is why we have a crisis killing over 100,000 Americans a year, and I'm sure the data in Canada is significant. So,
Yeah.
many people go and innocently get prescribed something after a surgery, not knowing they take it. It helps relieve their pain. And they know 2 weeks later they're addicted. It happened to one of my neighbors, a 71-year-old
Oh.
attorney, for a shoulder surgery. And next thing I know, he's addicted to it unknowingly because they're very addicted with lots of side effects. And many medications are very addictive. I mean, sleeping pills and benzodiazepine, that's going to be the next big rage because there's a massive problem with addiction there.
And what is
You know,
that,
if
Dr. Mike? What is that? What is
drugs, benzodiazepines are drugs like Xanax or Valium or Ativan. They're for anxiety typically, right? People take them for anxiety and to sleep. And, yeah, they may reduce the anxiety. And many people take them and fall asleep with their Xanax, but it changes the brain chemistry. They get very addicted. It's very hard to get off. Very. That's one of the more difficult addictions in the world to come off of. And it really can affect the brain negatively over time. It does. So these things are very tricky because you can go, wow, I slept great. It made me feel great. And then, you know, and my anxiety went away. And, there's typically a big cost. And, I can't emphasize enough. It's always important to look at lifestyles and stress management. We spoke before about yoga and meditation and those tools and, mindfulness and just a good mental attitude and acupuncture for pain. But, medications, people have to be aware and, talk to their doctor about healthier alternatives and say, ask if they're available. And then, they could look at what we offer and look at their lifestyles, very important options.
Dr. Mike, you're probably gonna laugh at me, but last year I see you're already giggling. I had COVID last year and I had the really bad, what is it, the headaches and I get migraines and I was taking Advil and I'm like not a huge fan of Advil, like just because I know. So I was taking Advil, but at the same time, I was taking stuff for my gut. I was taking L-glutamine. I was taking bovine colostrum. And so I'm like, okay,
Great.
I'm going to try and mitigate these, potential side effects because I was taking it for a few days. And I think people think, oh, well, I'll just pop an Advil or I'll just pop, whatever, a leave for my pain.
Mhm.
But over time, like I was even paranoid about taking it over a period of, I think it was 3 days. So, and same thing with Tylenol. Like it's don't they have issues in the hospital with Tylenol overdoses and they give them
Oh yeah. Yeah,
N-acetylcysteine through IV and
that's one of the worst overdoses in the world is Tylenol. Because if you go into liver failure, there's often no turning back, and Tylenol in high doses can be extremely toxic to the liver, and it's one of the causes of suicide. And people commit suicide with Tylenol
God. Okay.
by going into liver failure.
So
But
here's a
again,
question.
and everyone has different genetics and everyone has different sensitivities. So
Yeah.
again, there's a lot of people take a few ibuprofen, they have an injury and they'll have some swelling, take it for a few days or a week, and it's not a big deal. It's chronic use is concerning, but there's some people who will take two ibuprofen and get gastritis and really start to get
Yes.
acid regurgitation. So we're all different, right? But again, it's still better to use if you can get away with something natural that doesn't have a risk of side effects or that can help you lower the doses. As I mentioned to you, one of our studies showed you could combine theramine with the anti-inflammatory naproxen, reduce the dose dramatically. And I found this in practice was often getting people way down on anti-inflammatories by combining theramine and sleep meds
Amazing.
as well and lowering the side effect profile.
I have a question. It says we're talking about liver. How are these processed in the body when you take them?
I mean,
Like,
neurotransmitters are like anything; they're just part of our regular metabolic pathways.
yeah.
Uptake, breakdown. You know, Normal. These are health they're naturally made.
Yeah, because
And we're
anything,
just providing some precursors.
because also, one of the things I always say is that if it's more natural, yes, everything still has to be processed through the liver, but your liver can recognize these nutrients versus something more synthetic, which is why something
Mhm.
like Tylenol would be harder on the liver. Does that make sense to you?
Yeah, well, Tylenol in particular, there's certain metabolites that the liver just doesn't do well with, you know.
Right,
So
right. Okay, so let's get into the like who would use it for what. Just it's just more of a application. So arthritis is huge as
yes.
osteoarthritis. I mean, that can start at a very young age. There's rheumatoid arthritis. Those are known to be very common pain, chronic pain conditions. So in that case, I think which one did you, Theramine? Did you mention that one?
So theramine is the one we've used the most widely
Okay.
because it's for chronic pain and inflammation is often playing a role, the inflammatory
Yeah.
process in many of these pathways, especially arthritic pathways, joint inflammation, right? We also have tretinoin, which is specifically for osteoarthritis, but I've had many people try one, the other. Some people do better on both. Again, these have no interactions negatively, no drug interactions, no side effects. So people could try both theramine, tretinoin. I typically start with theramine. Tretinoin is specific to osteoarthritis. Theramine is wider for chronic pain and inflammation. Again, many people with chronic osteoarthritis have sleep difficulties. Many have obesity. So we have Centra PM for sleep and depression. We have Centra AM for cognitive decline and fatigue. We have Gabadone for sleep and anxiety disorders. We have Procura for neuropathy. So we have a large number of products, and we have Aptrim for obesity. It reduces
Hold on.
yeah.
Let's pause there for a second, Dr. Sinel, because everybody's going to want to hear. I just read something yesterday about how there's a shortage of this drug, Ozempic, because all the celebrities are
Yes.
buying it. They're because they got the money to buy it. So I'm like, oh my God. Like, and then there's people who really need it. So talk to me about this one for obesity. That's going to definitely stop people in their tracks.
Yeah, well, again, it's all natural. So it again works through balancing our nervous system to reduce craving, increasing parasympathetic tone. It's called Aptrim. We have two of them, Aptrim and Aptrim D. We have good data on it. We have people who've lost significant weight. There's a big obesity clinic, a doc who's been using it for, I think, 8, 9 years now with
Yeah.
all his patients to reduce cravings. It's a supplement. Look, weight loss is a difficult thing. So obviously there's the lifestyle aspects. You're a nutritionist, there's the proper diet, there's the psychological aspects, there's the exercise. But if you could reduce cravings by balancing neurotransmitters, that's a big difference. And if you could, take away that part of your appetite that is eating through anxiety and stress. It's a big deal.
Yes.
So again, it's a natural option. Again, nothing to lose. Many people do extremely well. I didn't use it as much in my practice, but I did have a lot of people with pain who tried it. It wasn't my specialty, but many did well. Our chief medical officer, who's an internist, has many people who've taken it successfully, and his partner, I think, lost 85 pounds and kept it off like 7, 8 years now and uses it regularly. He's a rheumatologist
Wow. The
with
reason
Aptrim.
The reason I think it's interesting is because, I work with a lot of midlife women, and a lot of their
Hmm.
issues are
Yeah.
cravings, right? Which
Hmm.
is linked to the neurotransmitters, and it's linked to that emotional eating, right?
Of course.
So that
Mhm.
makes sense. I feel like that's, with a lot of people, half the battle. And then, of course, there's knowing the right foods to eat, right?
Oh, of course. It's
That's always,
always,
yeah.
hitting things. It's lifestyle management is key in everything, And we have Procura for neuropathy, and many people suffer with neuropathy. Many diabetics, many alcoholics, many people have neuropathy. We just don't know what it's called, but it's a terrible disease at times, and there's very few options. The pharmaceutical option of gabapentin and Neurontin, can work for the pain symptoms, but also has a pretty high side effect profile. Many people get fatigued and memory loss and confusion.
Can
So
you
this
can
is a
you
safe option.
can you explain what neuropathy is exactly? Because I don't really know a lot about it.
Yes, I mean it's disease of the nerve, typically nerve pain or tingling or numbness. The nerves are carrying
Um,
sensation, but like in diabetics, you have compromise of the microvasculature around the nerves, and you're getting, a lot of people have pins and needles sensation and loss of sensation and very painful pins and needles often, and just nerve pain.
oh,
So nerve
interesting.
pain is neuropathy, as a subset, and Procura is one of our products that works well. And again, I encourage everyone to look at medicalfoods.com, because the unique thing about we have really deep data, long term, 12 plus years of history, and big science behind these, with big safety. So again, scientifically proven, they're safe, they're efficacious, there's no downside risks, no drug interactions or side effects. I'd love to talk to your doctors about how they could modify your meds, which is really quite simple. Start the medical food, and if you're doing well, slowly decrease. May it be your sleep medicine or your anti-inflammatories. And typically, what I tell doctors, it's the art of it. Just slowly cut things down. So.
Beautiful. Okay. Now, is there anything that we missed that we didn't talk about that you wanted to cover off?
Um, I mean, just I think there's an important shift happening where we could use natural medications and promote natural healing in the body, and the medical foods category is going to come to the forefront more because of the challenges with supplements not being really regulated. And the FDA in the US has been cracking down on the marketing claims of supplements because the manufacturing isn't regulated. So people have to be able to really discern good from bad, which is difficult from a
It is.
consumer perspective. And the manufacturing, might not be great in all cases. And again, they're all also based on vast majority theoretical science versus human clinical trials. So we have a category that is big science, that is safe and is not pharmaceutical, which again, there's a great role for pharma if you need it. It could be critical. Take the right antibiotic if you have an infection progressing, or a number of other things, but you have to use caution. And I always believe if you could have something to reduce the dose or lower it, that's a safe option. You should consider it and educate yourself. And I'm excited to educate your doctors, Dr. Mike at medicalfood.com and medicalfoods.com. And yeah, just excited for people like you to help educate the public and bring these out.
Here's a question for you. If you have a chronic condition, such as, let's say, osteoarthritis, do you have
Yes.
to take this forever? Do you pulse it in and out? Do you,
Mhm.
like, how would you take it?
So again, if you think of it, it's nutrition, right? So you often might, I mean, we have people who've taken it for 6 months, balanced their neurotransmitters, and then were eating properly and got better. We have a
Hmm.
number of people who've stayed on these for years, but there's no toxicity if you're on them,
Yeah.
and they're going to be extremely reasonably priced, especially your clients will.
Yeah.
So, I mean, it varies tremendously. You don't have to pulse them because they're amino acids and botanicals. So you're just producing your neurotransmitters that you need and peeing out the rest. So
Yeah.
there's no downside risk with them. And some people stay on them. I tend to tell people, give them at least a month or two, sometimes 3 to work. Because again, you're bringing up levels that were depleted, that's of the neurotransmitters. So it might take some time. Some people respond quick,
Yeah.
but some take some time to work. But I tell people, just go into it. And like anything, when you're on it for a long time, see if cutting back on it and having good lifestyle and good nutrition, if your symptoms are going away or staying away, then great, then stop taking it. But
Yeah.
there's no
Okay.
problem combining these. And again,
Perfect.
safety profiles are.
Perfect. All right, Dr. Mike, where can we find you? What's the website again?
Medicalfoods.com. Super easy, or medicalfoodsinfo.com, but medicalfoods.com. And I'm Dr. Mike at medicalfoods.com.
Perfect.
And excited to spread the word together.
And I will also have all the information in the show notes. Thank you so much. I really appreciate your time today, Dr. Mike.
Thank you. From Abu Dhabi, from Dubai, of all places. Interestingly.
You're traveling too much these days.
Yes, I'm trying to bring these out to the world. So
I love it. Thank you.
Okay. Have a great night. Bye-bye.
Okay, I actually stopped on the audio. That was really good.